Well, acne is the most common skin disease, and very few people manage to escape it, especially in their teenage and young adult years. But new research is giving hope to sufferers, and dermatologist Dr. Natasha Cook joins me now. Good morning to you, Natasha.
Good morning, Lisa.
Can you tell us about this research and what's been found?
Certainly. So the research basically focuses on the discovery of an ingredient which is known as lauric acid. Lauric acid is a medium-chain fatty acid that's found in a lot of naturally occurring substances such as coconut milk. And what they've discovered about lauric acid, where it specifically helps acne, is that it's an antimicrobial or an antibacterial against a bacteria that contributes to the development of acne, known as P. acnes or Propionibacterium acne. So by reducing that load, it can actually help reduce the inflammatory type lesions like the pustules and the pimples. But the important thing to realise is this is certainly not a cure. It's just an alternative treatment that may prove to be very, very effective. And its other advantage is that it's probably less irritating than a lot of the commonly known antibacterials that are available, such as benzoyl peroxide, which would be a massive advantage because a lot of people have problems tolerating that.
Would this be something that would be applied to the skin or something that you'd take in a tablet form?
Certainly the studies that have been done are using it in a topical agent, so actually putting it onto the skin.
OK. I was looking at the figures. Somewhere between 70 and 85% of Australians suffer from acne. What actually causes it?
That's true. 75 to 85% do suffer from acne. And you've got to realise that acne is not just big pimples and pustules and cysts. It also includes blackheads and whiteheads. So it's quite a spectrum. What actually causes acne fundamentally is your genetics and your hormones and how your hormones act and program your skin. It's certainly not dirt, and it's certainly not diet, which are big fallacies. OK,
well, let's go through those. Because lauric acid isn't available, when do you think it will be?
Well, the research is very much in its experimental stages, so when that's going to be available to the general public is indefinable at this stage, but it's very promising.
OK, so in the meantime, your tips are people should see a dermatologist?
That's right. What people have to understand is acne is actually a disease of the skin. And so seeing a dermatologist, you can make sure that you get the right treatments depending on what grade of acne you have and ultimately end up with clear skin.
Because they can really assess you face to face.
Correct.
Don't over-irritate the skin. What irritates acne?
Well, a lot of fallacy is that acne is all about oil and dirt. So people over-clean the skin using harsh cleansers and scrubs, and this can actually flare acne and make it significantly worse.
Next one is don't squeeze your skin. Gee, that's hard to do if a pimple comes up.
It certainly is, particularly when you've got a nice juicy pustule there. It's tempting. The problem is if we squeeze the pimple, we actually contribute more damage, more inflammation, and therefore potentially lead to scarring.
And it forces it back into the skin, does it?
Yeah, potentially it can. It can actually make the pimple actually worse.
OK, you mentioned there don't think that it's diet, and consider a hormone test. What would that do?
Well, for some people, most people who have acne that's due to their hormone levels are normal. But in some cases, particularly in women, if it's associated with irregular periods, and other symptoms, they may actually have an underlying hormonal imbalance, such as polycystic ovarian syndrome, which actually occurs in about 1 in 3 to 1 in 4 women. So it's really important to get these investigated.
Yeah, it's not just a teenage problem, is it?
Not at all. About 1 in 3, 1 in 4 adult women also suffer from acne, ongoing.
Okay. Well, some good news there on the horizon and plenty meantime.
Fantastic.
Natasha, thanks very much for your time.
Thank you.